Hi everyone, welcome to Beyond Your Knowledge. Well, now we are going to see when do we use arteriolar vasodilators. Okay, so before we continue, verse 11 says, "Whoever trusts in his riches will fall, but the righteous will flourish like a green leaf." Okay, so to understand this, I think that would be important that we separate between arterioles and veins. Okay, so basically, as we know, arterioles has smooth muscles. Okay, and the blood is the one that comes from your left heart to the arteries, to the arterioles, and then all those, and then come back to your heart through your veins. So it's coming back, but now, and this one go everywhere. Well, this is arterioles. Now there are some drugs that we're going to see here that they are called the arterial vasodilators. Okay, so arterial vasodilators, we can give couple examples, and one of those is called hydralazine, and the other is called minoxidil. Now, what do they do? Well, they are going to decrease your blood pressure for sure. I mean, this is the purpose, okay? But how do they how those hydralazine, those drugs, hydralazine and minoxidil, how do they decrease the blood pressure? Well, because they reduce the systemic vascular resistance. Okay, so because remember that the problem, sometimes the patient can has hypertension, and we can say that the patient has a resistant hypertension. So, and another way to think about it is we have systolic and diastolic pressure. Okay, so systolic and diastolic. So the systolic pressure is represent resistance, and the diastolic pressure represents volume. Now, those patients that they have resistant hypertension, so they are going to have resistance, so systolic, and also the blood pressure sometimes extremely high, and yeah. But yeah, so let's see, continue coming back again to hydralazine and minoxidil, which we're going to decrease the blood pressure, reducing the systemic vascular resistance. Now, the effect, so how this effect happen? So this effect is limited by the subsequent stimulation of the baroreceptors, and then so you stimulate, so because you want to decrease that pressure, you're going to stimulate, okay, your baroreceptors. Okay, so, and let's see, so probably would be a good idea if we figure out what is a baroreceptors. So basically the baroreceptors are mechanoreceptors, and they are located, so first they are mechanoreceptors and now they are going to be located in the carotid sinus, so as we can see right here. Okay, so let me just do this here in red better. So this is a carotid sinus, they're located right there and also they are located in the aortic arc. So but what is the purpose? So we saw the location, the carotid sinus and the aortic arc, but the purpose of this is going to be to detect, so to detect or to sense the response about the pressure. So it basically sense the pressure changes. So if you have a pressure changes, so it is important that those things go, the carotid sinus and the one that is aortic receptor, so they detect it, but they are very sensitive. And also, so one time they respond, so they can happen a fast changing in the levels of the blood pressure. And so one time those levels happen, I mean those changes happen, so there is going to be a reflex. Okay, so and this is something that we're going to see here. So one time stimuli is going to be a reflex. Okay, so this reflex, sorry, so it's going, this is going to be a reflex of the sympathetic activation. Okay, so when I think in sympathetic activation, so we need to think how is the patient is going to present. So I will go now to the other slide here. So I'm going to do square here so that we can see there is the continuation. Okay, so basically we can check the heart. So the heart rate is going to be high. Okay, so when the sympathetic activation occurs, so the heart rate is going to be high. Okay, also the other that is going to be affected, it is going to be the contractility and the cardiac output. So we have three things are going to be high: heart rate, contractility, and the cardiac output. I'm going to abbreviate those three. So they're going to be high. Okay, so due to what? Due to reflex sympathetic activation. Okay, so that we saw right here. Okay, now also in addition to the sympathetic stimulation, so there are going to be activation also of the renin angiotensin aldosterone system. Okay, so the renin so this renin angiotensin aldosterone system axis, so it's going to be stimulated. Okay, I mean it's going to be activated. And what's happened, so the patient is going to start to retain sodium. Okay, so and then if you have a sodium and fluid retention, so then the patient is going to present with peripheral edema. Okay, so how the patient is going to present, and we just do this line here, peripheral edema. Now the effects, so usually we don't use those drugs that we mentioned here, the minoxidil and the hydralazine. We don't use it, that is extreme cases. Okay, so now so basically they are rarely used so as a monotherapy. So usually we use it with a combination with another drugs. Okay, but if the patient has an so in an acute situation, so where the elevated blood pressure is very severe, so we can, but so when we use this in combination we use this with sympatholytic, I mean we use this with sympatholytics. There we go. Yeah, sympatholytics. And also if you see that the patient has fluid retention, the patient has peripheral edema, so we need to give a diuretic. Okay, yes, yeah, so to basically to decrease or to avoid that the side effects become worse. Okay, so when the patient that has, remember, resistant hypertension. Okay, now it is important that we drink water. Why? Because that's help to keep our pressure regulated. Okay, because when you are not drinking water, so you are suffering more constriction of your arterioles. Eventually when your volume decrease, okay, so basically the consequence. But yeah, so if we do this, I think that would be helpful. But in this kind of patients, so we need to check the kidney and all those things before we giving fluids, because remember they have fluid retention. But we need to be careful that they don't get dehydrated or that they lack any of the electrolytes. Okay, and now, so with that in mind, we can stop here, and thank you so much. God bless you, and remember, we can do all things through Christ who strengthens us. Enjoy and have a blessed day.